Have you ever had a patient just completely ghost you about halfway through working with you? Well, if so, you are not alone. Statistics show that 50 to 70% of all patients don't follow through with their care plans because they have no clarity, they have unrealistic expectations, or they just feel discouraged because they didn't get immediate results. So today, we're going to talk about how to keep patients engaged, compliant, and confident in your ability to help them. Let's get started. Welcome to the Clinical Entrepreneur Podcast. I'm Ronda, your no-fluff, tell it like it is business bestie for wellness practitioners just like you who want to build a practice you love and make a bigger impact and a little money while you're at it. So if you're ready to ditch the overwhelm, attract your dream, ideal patients, and finally run your practice with complete confidence, you're in the right place. Each week, we're tackling things from programs to patient retention to marketing strategies that actually work, sprinkled, of course, with a little sass, a lot of heart, and the step-by-step strategies that will help you get there. So grab your cup of coffee, your notebook, or whatever keeps you going, and let's build a practice you love and a life you love together. It's happened to all of us. See that patient that comes in and you think, oh my gosh, this is going to be the perfect fit. I can help you. You lay it all out. You give them all the information and they seem really excited. And then maybe they never call you back. Or maybe they came in for that first appointment, but then they didn't follow through and they don't show up and they just ghost you and they don't return your phone calls and they bought one round of supplements and then never see or hear from them again. What happened? We tend to think, well, maybe it's money. They probably couldn't afford it. And I think, honestly, that's cop out. So I think that's your and my limiting belief or mindset that needs to shift around money. We always want to make it about, well, it's the economy or it's the election or it's this, that. It's not that. People spend money on the things that they value. You do it and I do it. If I value something enough and it's expensive and it feeds my emotions, it makes my life easier, it's going to solve a problem for me, I'm willing to spend the money to do that. And we forget about that. We tend to want to blame it on, well, maybe it was me or maybe it was the weather, whatever. I believe that there's probably another reason that's even deeper, more so than money, more so than the weather or the clothes that you happen to wear that day or whatever. I think it's because they don't know what to expect, that we haven't laid it out clear enough for them to highlight the transformation that they're going to achieve. We talk about this in Clinical Business Academy all the time. It's about the transformation. But the problem is that getting from where they are to where they want to go can be a little bit bumpy. There's going to be some ups and downs. There are going to be some symptoms that maybe are going to be a little unpleasant, or they might be a little more tired for, a period of time, or they may experience a little bit more bloating, or they may have some die-off. And I think we need to set those expectations clearly, because when they know going in, this is where I'm starting, this is the path I'm going to take, and this is the outcome I'm going to get at the end, then they're far more willing to get through the bumpy middle part. I call it the messy middle, but they're far more willing to get through the messy middle when they can get to the end and go, oh my gosh, that was so worth it. It's kind of like cleaning your house. I don't want to clean my house, but oh my gosh, I love it so much when it's done. And that's why I do it, because I like to have it clean and vacuumed and dusted and picked up and straightened and the dishes in the dishwasher, all the things. Then I feel like at peace, at ease. It's sort of the same thing. So our job is just to lead them through this experience, but by setting really good expectations. So we want to give them a bit of a roadmap. And I've talked about this before. You can do it yourself. You can create one in Canva if you'd like, or you can just write it out. It doesn't have to be anything fancy, but they need to have a roadmap. So I'm going to give you 5 steps that will help you be able to set really good patient expectations from the very, very beginning. So number 1, You want to break their treatment plan into stages or phases. And again, I talk about this all the time in Clinical Business Academy. When you create a program or a care plan, many of you will call it that, when you create that for someone, it has to have a phase or a stage. So think about this. I'm a patient and I'm going to go to the chiropractor, and I pick on chiropractors all the time. I love you all, but I am going to pick on you. And so I go to the chiropractor and I hurt my neck or whatever. I slept funny. And the chiropractor says to me, okay, Rhonda, I need to see you 3 times a week for 2 weeks, and then twice a week for 2 weeks, and then once a week for 4 weeks, and then we'll reevaluate. Well, I might say, yeah. I just have pain. My neck just hurts. Why do I have to come so many times? I'm adding up in my head. 3 + 3 is 6. That's for 2 weeks. And then twice a week for a couple more weeks. So that's 10. And then once a week, that's 14 times I'm going to have to come and see you. And what? No. And patients do that all the time. And why would I say no? It's because I don't see the value. I don't understand what's going to happen to my body as I'm remodeling and recorrecting those subluxations, getting my spinal cord and my nervous system back in line. I don't understand. So if the chiropractor sat down and said, okay, here's what's happened. Here's what's happened in your neck. Here's where we want to be. And this is what we need to do in the middle. The first 2 weeks, this is what's going to happen. I need to get in there and adjust it 3 times. And here's why. Because blah, 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 blah. The muscles and the nervous system, blah, blah, blah. And you explain it to me. Now I have context. Now I have value. Now I go, oh, I get it. That's why we have to do it this way. So now you say, okay, then the next 2 weeks, you don't have to come as often because we've done X. Now we're moving into Y. So do you see how this is like phase 1 would be those first 2 weeks when it's a little bit more intense. If you work with people, if you're not a chiropractor and you work with someone who has digestive issues, let's say, you might say, okay, adjustment phase. We're going to call it phase 1. It's the first 2 weeks, and this is adjustment. This is where you might have some symptoms of a little bit more bloating. You may find that you have a little bit more constipation. It's okay. I'm going to give you something to support that. You may have a little bit of fatigue, but all of that is going to resolve. But it may happen during those first 2 weeks, and here's why. And then you go on, you say, okay, the second 2 weeks, or in the chiropractor's case, the second 2 weeks are going to be the adjustments. Maybe with the digestive patient, you're going to say the second 2 weeks or the second phase is when we're starting to see some balance in your digestive system. The bloating is going to go down, significantly down. Your energy is going to improve, and we're going to start to see the foundation for the long-term changes so that you don't end up back in this place, 6 months from now. And that's maybe phase 2. And then you say, okay, phase 3 is when we're going to optimize. And the phase 3 optimization is, okay, how do we fix your diet? Or the chiropractor might say to me, we're going to optimize your posture. We're going to optimize maybe your work environment so that you have a really good chair. Or let's optimize your sleep. Let's look at your mattress and your pillow and the way that you're sleeping. Do you see how you just lay the plan out? And now all of a sudden my brain goes, oh, I got the plan. Oh, and I can now see the outcome, and I'm willing to invest the resources to get the outcome. So that's step 1, is you really need to define the journey very clearly. The second step is to normalize the symptoms. And by that, I don't mean to minimize. I'm not talking about that. I want you to think about how do we normalize or let them know that these maybe some unpleasant symptoms are okay. So the chiropractor might say to me, your neck isn't going to feel great for the first 10 days. You're going to have a little bit of, hitch in your giddy up there. And you might need to go easy, or we might need to put some, Ortho Pro. I love that product. Ortho Pro on your neck. You want you to do that for the next couple of weeks because it's still going to be a little tight and sore. Same with the digestive patient. You're going to say something like, you may have some temporary bloating. If it resolves quickly, that's totally fine. However, if you notice that you have any sharp pains or something doesn't feel right, or you're not able to eliminate for more than 2 days, that's when you need to let me know. Now I'm feeling safe because you've let me know what I can expect, what's normal, quote, maybe the unpleasant symptoms that are normal. And you've also set a boundary to let me know when I need to contact you. how many times have you had, I've had this happen so many times, where a patient will say, oh my gosh, well, I just was so miserable, but I went ahead and did the 21-day liver detox because I just thought that's what I was supposed to do. But I was so bloated and miserable. I felt nauseous every single day for the whole 21 days. I think, well, why didn't you call me? If you had called me, I know exactly what the problem is. I could have fixed it. But I didn't do a good job setting those expectations. If this happens, let me know. Because it might mean that we just need to adjust the dose or remove a product or switch something out or something. But we have to set those expectations and normalize, quote, what they can expect. And if they do experience these set of things, then to let me know. And you can even create like a, I don't know, use ChatGPT if you want and create like a what to expect guide. You know, what to expect during the 21-day or a 3-week liver cleanse. What to expect when you're doing a, anxiety reset. What to expect when you're doing a beat the bloat challenge, whatever it is that you're doing. All right, that's number 2. So to review, number 1, you have to define the journey. Number 2, we're going to normalize those symptoms. In other words, let them know what's normal and let them know when they need to contact you so that they can have a great experience. Number 3 is set clear milestones. And I talk about this all the time. Again, when you're creating something that's a program or a care plan that's a longer period of time, so maybe it's 6 weeks or 4 weeks or 8 weeks or 12 weeks, the patient needs to know what to expect rather than, oh, you'll feel better in just a few weeks. No. We want to be more specific than that. By week 2, your energy is going to be up. By week 3, your sleep is going to change. And by week 6, your bloating will likely be all the way gone. If it's not all the way gone, it'll be 90% better. And you can say that with confidence because you've done the work. You already know. You've worked with patients that have these conditions before. You're an expert. Lean into your expertise. You've seen it over and over and over again. I've done the 21-day purification from standard process thousands of times with people. I pretty much know what to expect. Is it like a fork in the road? They're either going to have this happen or they're going to have this happen. I know it. I've seen it so many times. So I can with confidence say, during week 1, here's how you're going to feel. During week 2, here's how you're going to feel. And I could even be more specific and say on about day 5, on or around day 5, because I've done it so many times. So I know exactly what to kind of prime them for. Does that make sense? So you want to set those milestones. Let them know. How will they know that they're making progress? Not just, oh, you'll feel better in a few weeks. We'll get through it. Don't worry. Just keep going. I don't like that. I want someone to say, here's how you know you're making progress. When I know that my neck is starting to feel better and the chiropractor says to me in a week, you're going to notice more range of motion left or right. It's going to be easier and you'll be able to roll over in bed without pain. And so I'm looking for that now. You've primed me. I'm now looking for that. And then when it happens, I go, oh, I'm in good hands. He knows what he's doing. She knows what she's doing. And now I can feel confident that I have invested my money wisely, my time is being spent well, and I'm going to get the outcome that I want. So celebrate their wins. Like, congratulations, that's awesome. I'm so happy that your range of motion is better or that your bloating is better. The next thing you're going to experience is X. So set those milestones up for them and then celebrate. Number 4, let them know how and when to reach out. This kind of goes back to normalizing the symptoms a bit, but you know your patient, you know what's going to happen. Let them know when are the times that they really do need to reach out to you. So if you're dealing with someone that has anxiety, for instance, you may want to say something like, I know that the anxiety might want to come up and kind of bite you a little bit because you're going to feel a little bit unsure, especially if you're not feeling better right away, or this particular thing happens, whatever it might be. I want you to let me know, and then tell them how to let you know. In other words, do you want them to reach out, in a patient portal where they can ask questions? Do you want them to email you, text you? How do you want them to reach out? And then make sure they have that information. They're clear about how to do it. There's something about knowing that I can call or reach out if I have a question or a problem versus just feeling like I'm an inconvenience and I don't know whether I should call or not call. Is this something? Is it not something? And I'll tell you, I have had this happen so many times, and it's my failure as a practitioner. It's my failure for not informing the patient, this is what you can expect. This is when I want you to call me. If this happens, then call me. And it's not because it's horrible. It's just because I want to know, and I may want to adjust your symptoms. Here's a great example. Sometimes I'll use ashwagandha or another adaptogen for someone who's really feeling the effects of stress, anxiety, like they just kind of can't settle or calm. I want to get a great response for them right away. So very often I will up the dose a bit. Right in the beginning, I'm like, let's go. So I might do 4 per day when normally I would do 3. But I want to get that anxiety under control, or I want to get them so they're not feeling so much overwhelm in their daily life. But I know from doing this for so long that one of the, quote, I'll call it a side effect. It's not really a side effect, but one of the things that can happen is it can make the patient feel sleepy. And they don't like that. So then if I don't prep them for that symptom, if I don't prime them that this could happen, and if it does, just let me know and reduce the dose by 1. Now I've kind of let them know what to expect. So now I've normalized the symptoms, but I've also given them clear instructions about how and when to contact me. If you makes you feel sleepy, let me know. We'll drop the dose by 1, but I want to know because it helps me know how you're responding to these herbs. And they're so happy because they feel supported. They feel like okay with the fact that I know what might happen. And, you could argue that the placebo effect might kick in. Yeah, so if it does, great. If they get sleepy, they say, oh, I can't take, fine, drop them down to 2. Great, the supplements will last them a little bit longer. I don't really worry about that. I used to say, oh, I don't want to, this is many years ago, I used to say, well, I don't want to tell them the things that might happen because then I don't want to, I don't want to lead the witness, so to speak. I don't want to put things in their head and then have them make it up. But I realized later that that was not really the best plan because they didn't feel safe. And I want them to feel safe with me. I want them to feel like, I got you. Like, I'm your safety net. You can jump out of that 5-story window and I've got the big trampoline at the bottom. I'm going to catch you. It's all going to be fine because I've caught thousands of people before you. So I want to make sure that they know how to reach out and when to reach out. Now I can hear you saying, oh, well, they'll just abuse it. They'll just text me all the time. Listen, this is when the 80-20 rule comes into play. 80% of your patients will never abuse it, and they probably won't reach out because they'll be like, I think this is fine. I got this. I don't need to. Only 20% or less will be the ones that are going to blow up your chat, blow up your text, blow up your patient portal, where they can ask questions like in Practice Better. Only 20% of people are going to do that. And if they do, friend, that's on you. You have to go in and set better expectations. You just have to say, hey, listen, I'm super happy to answer your questions. However, when there's 3 or 4 or 5 questions a day, I've had this happen, when there's a whole bunch of them coming at me in a day, it's inefficient for me to be able to answer them and answer them thoroughly. And so I'm going to ask that you put them either all in one email so that I can look at them all together. And if it's more than I can answer succinctly and give you a good quality answer in that email, then we're going to just set up a quick appointment and then we can just talk through them because that's going to take a lot less time. There you go. So you have to set those boundaries back with them for that 20% that might abuse it. All right. Let's land the plane, shall we? Lastly, number 5, it's real important that you anchor them in the bigger vision. You want them to see what's coming. You want them to see their why. You want them to see the transformation at the end. It's so easy for us. I'm sure I'm going to say us. I was going to say, well, maybe just me, but it's us because we get caught up in the minutia. We're in the doing. We're in the, okay, first you're going to do this, then you're going to do the 21 day, then we're going to put you on this, then we're going to do this, then we're going to fix your female hormones, then we're going to blah, blah, blah. And we get caught up in all the little details and we forget to come out of the minutia, fly up to that, 1,000, 2,000, 5,000 foot level and help them stay focused on the big win. Why did they start? What is the outcome that they want? When they forget the end goal, they lose their motivation. So we have to remind them, and we have to future pace them is what it's called. Imagine how this is going to feel. This is all going to be worth it because it's not going to be very long. And you're going to wake up in the morning awake. You're not going to want to stay in bed for hours. You're going to have energy. You're not going to wake up feeling ravenously hungry. And when you do eat, there's going to be no more bloating and discomfort. I got you. I've got you. You got this. This is what our outcome is. This is what we're going for. You're going to get there. I promise you. I've done this so many times. I know what I'm doing, and you got this. We've got this together. You want to refocus them on what that transformation is, or let them know, listen, you've already done the hardest part. Imagine where you're going to be in another month. The hard part's over. You got this. Because when the symptoms go away, they tend to go away. Right? It's like chiropractors, you're all saying yes and amen to that. Because when you get them out of pain, they don't come back. They don't recognize the value of really fixing the problem so that they have less likelihood of getting in pain later. So another thing that helps, just kind of as a sidebar, is whenever you can share a patient story from another patient and share it with them that's, in the same or similar situation, just let them know. I had a patient once who blank, and when they came in, these were their symptoms, and we did really close to what we're doing with you. There's a few little tweaks, but it's almost the same. And by the end of 2 months, this is what's happened. They had this benefit, this benefit, this benefit, this transformation. They're full of energy, no more bloating, feeling really good. And now this individual just comes in, she or he comes in maybe once every 2 or 3 months just for a checkup. We make sure everything's okay. We do blood work once a year, whatever. Just tell the story. If you're worried about HIPAA or PHI violation, the best way to do that is to change the sex of the person and maybe change the age. But you can still tell the same story. So if it's a she that you had previous experience with, then you call the she a he, and you say he came in and he was 35 when really your patient that you had was 55. You just change it up a little bit, because what if your patient knows the person? So you just change it up a little bit, and that keeps you from divulging anything you shouldn't be divulging. So here's what my takeaways for you are. I would say go back through your onboarding process. Think about how in the process of you setting up their report of findings, or you're making a recommendation on your care plan or your treatment plan, where can you set better expectations? And start slow. Don't feel like you have to do it all right away. Just start slow. But where can you set a better expectation? Just maybe add one thing. Think about one thing that you can do. Secondly, you can go to Canva if you want to get fancy, and you can actually create something that's like phase 1, phase 2, phase 3, especially if you do the same thing over and over. This would work great for the liver purification from Standard Process. Work great. So you can create a resource, a document. If you have used Practice Better, you can link that. You can provide that to them as a resource. You can, fill it out, because it's pretty standard for the liver purification. You just give them that resource, and then they have it to go with. You make it once and you just repurpose it. And then another thing you could do is you could create almost like a what to expect video for each phase of your process. So if you have 3 phases, that the first phase is your realignment phase, and then your transition phase, and then your optimization phase. I just made those up. So maybe you just do a quick video. The realignment phase is this. This is what you can expect. You just give them something that helps them take a deep breath and go, okay, I'm going to be good. I swear to you, I promise you, your patients will stay. They will refer. They will be so much happier, because the map for them, the plan for them, it's all laid out. And this will prevent them from dropping off. You refine the way that you communicate with them, and then they are able to feel much more confident in the process and really kind of dive in full on, like they're just full on, all in. That's what we want. We want them committed all the way to the end. So your patients will thank you. Your business will thank you. Your bank account will thank you. So go map out your roadmap. Go map it out for just one thing. Maybe it's the 21-day purification, or you do a different one. It doesn't matter to me. Whatever you do, that's just what I do. So you pick your thing, just pick one thing, and just start thinking about how you can create that roadmap. And then look for ways that you can optimize your communication with the patient. It helps you get clear so that we don't get down in the weeds. It helps you and I get clear, but more importantly, it really does set such a great framework for the patient to be able to sit back, relax, and go, I am going to get better. I am going to get better. There you go, friends. That's it. Thanks for listening to the podcast. As usual, if you love this podcast, you can share it, review it, subscribe, set upon your alert so you know when the next episode drops. All right, friends, take care. Talk to you soon. I hope you loved this episode. And listen, if you are looking for a faster way to get from point A to point B in your business, I got you. You need to be in Clinical Business Academy. Go to rondanelson.com/CBA. Get all the details and schedule a call with me. And together we'll figure out if this is a right fit for you. So take care, friends, and I'll see you next week on the podcast.